Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today we're taping this program right in front of Owen Sound City Hall. The reason for this is because this morning there was a rally. The rally is about private health care versus public health care, and the rally was brought to us here by Grey Bruce Coalition, Healthcare Coalition. It is really important to get the message out there, especially for rural health in Ontario, and the upcoming concern that people have that our Durham Hospital will close the beds. So today we're having a variety of conversations, and we are talking to people about why it matters and what they can do. So stay tuned, listen to what individuals say, and for those of you who feel that you want to offer a voice, please consider reaching out and supporting rural healthcare and Grey Bruce Coalition, Healthcare Coalition, to spread the message. Thank you.
The healthcare file is huge. There are so many different aspects to it that it's difficult to cover them all in the short time we have here this morning. There are issues with access to primary health care, ER service interruptions in small hospitals, substandard long-term health care, the intrusion of private clinics that are charging and overcharging patients for medically necessary services, birthing units that are closing or are already closed, critically limited access to mental health services, and I didn't order this win, but I will keep track of this paper. And you may have other examples of the ways that the current Ministry of Health is letting us all down. I'm sure you do. Some people have asked us if this is a political rally. We get that question a lot. The Grey Bruce Health Coalition is a nonpartisan grassroots organization that's not tied to any particular political party. We're not here today to support or campaign for any particular party. It's undeniable that many of the policies and much of the legislation you'll hear about today are the product, indeed the mission, of the current governing party. But we'll try to focus our comments on those policies and the results of implementing those pieces of legislature with which we disagree, and we'll make an effort as much as possible to avoid personal references to parties or individuals. We're prepared to take questions that will make some current legislators uncomfortable in the expectation that in doing so, we can foster necessary discussion and change. So what is this morning going to hold for us? Well, we have some speakers who will share their issues and thoughts with you and hopefully leave you with some food for thought. Maybe when you leave, you will want to share some of those thoughts with your friends and family and other people that you encounter as you go about your day. You're very welcome to take some of our leaflets with you to distribute or hand out. One way to let the government know your position is to write a letter to your MPP. We have volunteers on hand here at one of our tables who will help you if you would like to write that letter today to either Rick Byers or Lisa Thompson, depending on where you live in the region. We have lots of paper, envelopes, and pens just waiting to help you with that process. Or perhaps you'll feel inspired to get on a bus with us on May 30th and take the message directly to Queen's Park. There's strength in numbers, and the government cannot help but notice when thousands of people go to the seat of government to demand change. One thing they fear the most is bad press, and the picture of a large number of people who took the time to come and express their dissatisfaction definitely qualifies as bad press. Hopefully that will motivate the type of change we want to see. In the summer, we're going to be having a lawn sign campaign province-wide. You can sign up today. There's a table here where you can go and sign up to have a lawn sign reserved for you. And there are volunteers on that table to help you as well. We have only one request of you, and that is that you help us to keep our promise to have a peaceful rally. Some of what you hear will be upsetting, and we can certainly understand that there's a temptation to share those feelings. By all means, applause is welcome, and cheer loudly when you hear something that you like. A joyful noise is always welcome. Wave your signs and posters when you feel so moved. But please remember to respect other people's space and comfort level. We want everyone to have an equal chance to enjoy and benefit from this morning's gathering. Please make our morning a model for peaceful protest. So that's a little bit about what we're here for and how we see it going. We have a variety of speakers. I did mention some of the topics that you're going to hear about. I have a little something to say first, and I think I've lost my... Just a minute, the wind has not been kind to me. So when we're going around the area, handing out our posters and our flyers, we are often asked about the Canada Health Act. People ask us, what about the Canada Health Act? Is it still protecting us? Well, this is the 40th anniversary of the Canada Health Act this year. In 1984, building on the impressive work of Canadian icon Tommy Douglas, the federal government enacted this law. It's about publicly funded health insurance, commonly called Medicare, and it established the primary objective for Canadian healthcare policy. Everyone settled down, secure in the knowledge that with this federal legislation, we would be protected moving forward. We would have a public healthcare system that would be the envy of other countries and other jurisdictions. No longer would Canadians have to fear that their economic status would determine their lifespan and be a barrier for receiving healthcare when they need it, where they need it, and how they need it. My parents and their generation and generations before them could remember a time when a relatively simple disease or condition could mean an early death if you couldn't pay for the treatment you and your family member needed. Every family had memories of those who passed away without medical care. Oh, wait a minute. Did I say every family? No, it wasn't every family. It wasn't the rich who perished without required medical treatment. It was those who could not pay. It was two-tier medicine. As a society, Canadians recognize that healthcare should be accessible to anyone who needs it, and the democratically elected members of Parliament who would respect that view. When the law was passed, it was based on 5 principles that many of us still hold dear. Under the law, it would be publicly administered, i.e., operated on a non-profit basis. It would be comprehensive with a full range of services to meet most patients' healthcare needs. The act was supposed to mean that services would be portable, so it didn't matter if you were in your own province or in other provinces, you'd still be entitled to the same level of healthcare as anyone else. It was to be universally available to all Canadians, regardless of their economic circumstances, and accessible to every person in Canada without prejudice. That's what we understood it to mean. And because it was federal legislation, we thought, oh, this won't be able to be compromised by any provincial government. So what happened? Did we blink and miss something? We get asked so often by people as we travel around these 2 counties, why doesn't the Canada Health Act protect us anymore? Why doesn't the federal government enforce it? Well, frankly, there's big money to be made in healthcare, and not by the frontline staff, as we keep hearing, and as we have seen to our despair in this province, as our healthcare workers are often driven to leave and work elsewhere by low rates of pay and impossible working conditions. The government would have us believe that frontline workers are the problem. They're not. Our health care is being sold, lock, stock, and barrel to moneyed interests as public services morph into private companies that consider their bottom line before the welfare of patients. How many families lost loved ones in long-term care during the recent COVID crisis? Because it is a fact that COVID was not the only problem lurking in the hallways of those facilities. Rapacious profit-taking was also a factor. Over the years, the protections of Medicare have been chipped away bit by bit, including and especially in Ontario. Excessive executive compensation takes money from the healthcare system to support bureaucrats and businesses at the expense of other Canadians. Gotta find these papers. Okay, we know that, excuse me. Okay, we know that healthcare businesses have undue access to our legislators through the lobbying process, and that the same politicians that we elect to represent us end up beholden to those companies. We can see it in the bottom line every day. So the short answer is that the rich are having their way with our government. We must demand that the federal government acts as our watchdog on provinces that are selling off healthcare. If you want to write a letter today to your MPP, maybe also address one to the federal government as well. Tell them that for you, the failure to protect the Canada Health Act will be an election issue. Ask the hard questions of federal politicians on where they stand. If we elect you, what are you prepared to do to protect and enforce the Canada Health Act? And for incumbents, no matter which party, let's check their record on this issue and vote accordingly. So that's a few thoughts on the Canada Health Act. Thank you. Thank you. We need that protection. We had it. I think it was Joni Mitchell said something like, you don't know what you've lost till it's gone. And we sure didn't notice, did we? My co-chair, Nora, will introduce our first speaker.
Yeah, I'm a little taller. Good morning, everybody. It's my pleasure. First of all, thank you for coming. It's my pleasure to introduce our first speaker, Reverend Craig Bartlett. Craig is a minister in the United Church in Tara. He was originally from Newfoundland, but he did spend 25 years teaching English as a second language in East Asia, countries such as South Korea, mainland China, and Hong Kong. But about 3 years ago, he returned to Canada, and he's needed health care. And he is one of the 34,000 people in Grey Bruce counties who does not have a family doctor or access to primary care. So Craig is going to speak today about the crisis in primary care. Welcome, Craig.
That's fine. Good morning, all. I'll just talk about my personal experience and my impressions based on that. I moved from Canada to East Asia, first to South Korea in 1997. While I was in Canada, I always had access to a primary health care provider. Whether it was in North York, in Metro Toronto, Lindsay, in Victoria County, with part of now what's called Kawartha Lakes, or even in Dartmouth and Greater Halifax, I was able to find and have a regular contact with a general practitioner. I moved to South Korea, a place which people may still think of as a developing country. In that country, I had walk-in access to my GP. I had 48 hours, the longest I ever had to wait, for a local specialist, even for doctors in Seoul. The longest I ever had to wait was a week. I came back to Canada 3 years ago. Since then, I have not had any kind of primary health care. I have had to cobble my health care from a mix of the emergency department at Chesley Hospital when it was open, and now the diabetes clinic here in Owen Sound. This bothers me. And yet the prevailing attitude, the prevailing political attitude seems to be crisis? What crisis? As noted before, I'm among one of the 34,000 people in this area, one of the over 2 million people in Ontario who do not have access to regular access to primary health care. And the prevailing attitude of political attitude is crisis? What crisis? I have to every time I go to the local emergency department in Chesley, I have to concern myself with, is it open today? And there have been times when I've gone there when it has been closed. And yet the prevailing political climate is crisis? What crisis? The Ontario Union of Family Doctors says that it might be, within the next 2 years, the number of people in Ontario who don't have access to primary health care might rise from 1 in 7 to 1 in 4. And yet the prevailing political attitude appears to be crisis? What crisis? I ask you, is there a crisis? Is there a crisis? When people have to rely on emergency departments as their primary health care, is there a crisis? Yes, there is a crisis. And until, when nurses feel like the best option for them is to go into private agencies, and they're discouraged from working in the areas in which they live. We've heard stories about this. I ask you, is there a crisis? Yes, there is a crisis. And until every Ontarian can be assured of regular access to a primary health care provider, I say that no emergency department, no hospital, especially in rural and northern areas, should be touched at all. And I say further that access to emergency departments should be expanded to 24 hours a day, 7 days a week. And that is not asking for privilege. That is simply a stopgap measure. No one should be happy about the state of healthcare in this province until everyone can be assured that they will have access to a general practitioner or a nurse practitioner. This is the minimum that we should be expecting. And politicians of whatever stripe, does not matter which political party they belong to, all of us hold you to ensuring that this standard is met. Thank you.
Thank you very much. That was inspiring. And yes, there is a crisis. Thank you, Craig, for taking the time today to bring your thoughts to us and to bring such encouragement to address the issue of primary care. Our next speaker I'm pleased to introduce is Karen Gaventer. She's well known in our Grey Bruce community as a leader in the struggle for social justice. She has a long history of sharing the stories of those who are struggling to achieve respect and equal access to the benefits our society provides for some, but unfortunately not all of those who need it. Karen attended the University of Guelph, earning an honors Bachelor of Science degree focusing on ecology with a minor in psychology. Later, she established a career in healthcare, working as a program assistant for the Grey Bruce Health Unit, which I think is now called Grey Bruce Public Health, for over 20 years. Locally, she has stood as a candidate for the NDP party in the riding. As a person who has worked in healthcare herself, Karen is concerned about the varied impact of so many of these decisions on healthcare professionals in our local hospitals, services, and communities. And she's here to talk about that today. Karen?
Thank you. Yep. Good morning. My mom had leukemia 17 years ago, which has caused ongoing health challenges. My son had asthma, and my husband has had multiple health issues, including an ICU stay and several joint replacements. I have seen the importance of our public health care system. My family has received outstanding care because the medical staff care about their patients. However, how many of those staff were working overtime hours because the hospital just plain did not have enough staff to fill the shifts? According to the Canadian Union of Public Employees, the provincial hospital job vacancy rate has increased from 1.6% at the end of 2015 to 6.3% at the end of 2021. As of 2022, Ontario needed to hire between 22,000 and 30,000 nurses just to reach the national average. In 2023, there were only 12,000 nurses added to the College of Nurses of Ontario registrant pool. It's important to remember that hospitals don't just employ doctors and nurses. They also employ ultrasound technologists, medical laboratory technologists, respiratory therapists, cardiology technologists, just to name a few. The Government of Canada's Job Bank projected that the occupational group that includes respiratory therapists is expected to experience a labor shortage conditions between 2022 through to 2031. According to a Statistics Canada Job Vacancy and Wage Survey, the medical laboratory technologist shortage is approaching crisis levels. The situation is especially bad in small towns, rural areas, and northern regions of Ontario. What has caused this shortage? One of the big factors is wages. You may have heard of Bill 124, which was passed in 2019 and limited the increase in compensation rates for public sector workers, which included those in hospitals, to 1% each year over 3 years. When inflation is taken into account, that meant that the workers' wages were actually going backwards. Although Bill 124 was declared to be unconstitutional in November of 2022, it has done a lot of damage. Several unions hold Bill 124 to be largely responsible for the current worker shortage in the care sectors. With worker shortages and understaffing comes high level of burnout for those who are working in the sector. And this burnout also drives people away from their healthcare careers. Burnout isn't just a matter of physical strain and risks, but also emotional strain from challenges in meeting the needs of patients and families. It's also a strain on family life due to the amount of overtime. Ontario funding for public hospitals was the second lowest as a percentage of the gross domestic product in 2021, with only Alberta behind us. Due to underfunding, Hospitals cannot afford to pay their staff wages high enough to retain them. This government has funded private for-profit hospitals at double the rate per surgery than it funds public hospitals. And these clinics operate during the daytime, which draws staff who want to avoid shifts, overtime, and more difficult workloads. Our tax dollars should be invested in public health care, where they can be put back into the services, rather than lining the pockets of corporate CEOs and shareholders. Let's not forget the inequity of multi-tiered services for patients being built into this move to privatize. We see the trend of patients being pressured to pay for so-called ancillary services of supposedly preferable high-cost treatments in order to jump the long queues that have resulted from the underfunding of the public system. The underfunding and understaffing has very real and very direct effects. The South Bruce Grey Health Centre has reported that insufficient staffing has resulted in temporary hospital closures, with the Chesley ER being especially impacted. In a recent decision, the current provincial government has been given the ability to keep healthcare staffing shortages figures secret, after Ontario's privacy watchdog ruled that revealing them could be economically damaging. As Craig said earlier, the government is saying crisis. What crisis? It's sad that the government's reaction to this crisis and to the staffing shortage is to hide numbers rather than providing adequate and reasonable funding. Aside from increasing pay, there are other things that can be done to encourage healthcare workers to join or stay in that career path. Increasing workplace safety is very important, as is improving staff-to-patient ratios. A framework can be created to oversee privately run agencies and phase them out. Nursing certifications can be streamlined and financial barriers to post-secondary nursing degrees removed. Ultimately, we can have a viable healthcare system with increases to funding and improvements to working conditions. Thank you.
Thanks, Karen. It's really helpful to hear that kind of factual information about what is really going on. And I'd just like to relate one thing that people often say to me when we're handing out leaflets. They say, but if I can afford to pay and go to the private system, I'm really helping the public system. And the truth is, they're not. Every study that's been done, whether in Europe or here, has proven that, in fact, there's only one pool of staff that Karen has described. And that if you take people away from that public pool of staff to the private system, you, in fact, are increasing the wait times in the public system, and it leads to further underfunding of the public system. So we just simply can't afford to go in that direction. Right now, I'd like to introduce to you our next speaker, Barbara Fletcher. Barbara is a PSW, a personal support worker, and she works with people who are ill, elderly, or disabled, and helps them with their daily tasks, as all personal support workers do. This isn't an easy or even doable task in unfunded institutions of today, like our long-term care homes. Barbara did a short stint in a long-term care home, and then the last 24 years, she's had time in hospice, palliative care institutions, settings, and home care. She's also had the experience in the food service and logistics part of home care. She's certified in health and safety and the Charter of Human Rights and Dignity. And she'll be telling us some of her personal experiences today. But she's also here to speak on behalf of Deb Bogestein, who could not be here. Deb is a resident of the Southbridge Long-Term Care Home here in Owen Sound. Some of you may have read her very heartbreaking, poignant, and honest letter that was printed in the Toronto Star last week. So on Deb's behalf, she has met with Barbara, and Barbara is going to speak for Deb today as well. Barbara Fletcher.
Thanks. Good. Thank you for coming out, everyone. This is a shortened version of her story. But personally, I'm angry at the current system. Her words now. Trapped in bed and on my own for the night with no call bell, I'm dependent on a rotation of new, impersonal staff. A surprise admission call on a Friday evening set a move-in date for the following Wednesday. Management was unavailable for the long weekend, so I couldn't see the room beforehand. I had 5 days to clear my space and downsize to the new. That was not enough time. After a delightful first month, things deteriorated rapidly. Frequent staffing changes brought language barriers, inconsistent and subpar care, missing belongings, poor food, and a lack of reassurance. I spent almost a year without my vitamins or fresh fruit. Lunch is forgotten, supper is poor. I've grown accustomed to hunger and despair. Agency staff often ignore me. I've asked staff to leave because they say nothing to me when giving personal care. And for the record, I always talk to the patients. It puts them at ease. The high rent eats into my children's inheritance. Complaints are ignored. Many residents long to return to their previous homes as the situation became increasingly chaotic and disheartening. After many complaints, the ministry investigated. We held our breath as they paused admissions, listening to residents and families while management scrambled to fix issues. Promises were made and admissions reopened a few months later, but broken promises and unfulfilled solutions led to more disappointment. My spirit broken. I'm on every crisis list to get out, even if it means moving far from my family. Moving here has been disappointing. The ministry is not helpful. I've written a letter that's been published in the paper respectfully asking Doug Ford and Justin Trudeau to provide guidance regarding the matter of private health care, which has proven to be an evident failure. I implore them to reconsider promoting private health care so that it will prevent diminished care for our elderly and disabled. Sincerely, a frontline, boots on the ground client. Crisis? What crisis? That is only one person's story. These are my words now. Many others are more horrific, some of which you may have heard in the news. Being left to sit in soiled briefs and clothing, improper care leading to devastating wounds, and I've seen those wounds, missed medications, stolen belongings, lack of physical or mental stimulation, physical, mental, and other abuses, including financial, and vermin. I would like you all to do an exercise with me. If you could please close your eyes and try to imagine this person. In your mind, a person who needs assistance to complete the most basic of tasks. They may be wheelchair bound or bed bound or not. Now, try to imagine their face as being that of your mother, your father, your nana, your papi, or even yourself, some years from now. During my decades-long career, I've been made aware of many hazards and concerns of this type, and each and every person would beg me, please don't tell anyone. But the thing is, once I'm told, I am bound by regulations, policies, and procedures to report it. Many stories don't see the light of day because people fear repercussions, which they are protected against under the Residents' Bill of Rights, Section 5, which is found in the Fixing Long-Term Care Act regulation. But unfortunately, it does happen. Having worked in facilities, I can say this. Beneath the sparkly veneer lurks soul-crushing darkness. The people are warehoused, the care assembly line, much of it skipped to meet tightly imposed timelines. After the ridiculously high rents, they are charged extra for everything, thus draining their resources. The people feel faceless, helpless, and voiceless. I've seen how severely that affects their mental health and well-being. It's like a legal racket, and it's only going to get worse. How many mothers, fathers, nanas, or poppies have to get hurt or die before something is done? Article 5 of the Universal Declaration of Human Rights states, quote, "No one shall be subjected to torture or to cruel, inhuman, or degrading treatment or punishment," end quote. Article 25 states, quote, "Everyone has the right to a standard of living adequate for the health and well-being of himself or herself and of their family, including food, clothing, housing, and medical care and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or other lack of livelihood and circumstances beyond their control." Over the years, a great many of my patients have said they would rather die than end up in one of those places. And as I age, and I'm a boomer, please don't hate me, I am of the same mind. I tell you now, change is needed, and it's needed urgently. Act now before the cost in human pain and suffering becomes too great. Thank you.
Good. Thank you, Barbara. That was very moving. And so often when I hear speeches like this, it just brings a tear to my eye. And, you know, you can't help but think about people in your own life that you know may have been subjected to those horrific situations. My own grandmother, who pleaded with us never to put her in the old people's, is what she called it, on her first weekend was dropped to the floor because someone ignored a two-person lift caution, broke her hip, and started her on the final path. And that's not uncommon. It happens. We often get calls from people from nursing homes, as Barbara said, who will say to us, "I need to talk to somebody, but you can't tell anybody because they'll take it out on me." Or their children will call and say, "They'll take it out on my mom." It's very moving, and it needs to be fixed. I'd like to introduce our next speaker. I see him in the crowd. I'm honored to introduce Kevin Eccles. Kevin is the current mayor of the municipality of West Grey. This is his fourth term as mayor and his sixth as a member of council. He has also served one term each as councillor and deputy mayor. In addition, he has served on many boards, including Police Services, the Conservation Authority, the Health Board, and the boards for Germania Mutual Insurance and Northern Credit Union. The community of Durham falls within the municipality of West Grey, and today Kevin is here to talk about a recent decision by the CEO and board of the South Bruce Grey Health Centre that will result in the closure of the Durham Hospital, and about the cavalier attitude of the board, chair, and the CEO in explaining their actions to elected community officials who should have had advance notice but didn't get it, and to members of the community who are concerned about losing their hospital. Last year, about this same time, the small rural hospital in Minden was peremptorily closed by its board with little notice to residents. In our own area, Chesley, another small rural community about a half hour from Durham, also falls under the control of the South Bruce Grey Health Centre and is understood by all to be at risk as well. In fact, small rural hospitals throughout the province are being downsized and losing their hospital services at an alarming rate. No small rural hospital can consider itself really safe. Kevin was recently quoted to say, "If you have a rural hospital, Durham is just the poster child for this right now." And he's so right. His words in recent days and today will resonate with other small communities around Ontario who are aware they could be next. I give you Kevin.
Thank you, Gary, and thank you for those words, Brenda. As Brenda said, Mayor of the municipality of West Grey, Durham being the largest urban center in West Grey, and I've always said it was West Grey's the center of Grey County and probably the center of Ontario. To say that I was shocked on the 24th of April when the CEO had called for a Zoom meeting at 3 o'clock in the afternoon that had an announcement that was going to impact health care in the South Bruce Grey Health Center's sphere. And first thing she said was, yes, we're moving the 10 inpatient beds out. Yep, I know it was difficult for you out there and for everybody in West Grey to say that I was gobsmacked, speechless, something that doesn't happen very often to me. But I'm still, as the warden of Grey County said, blindsided. The first question that I did ask the CEO president was, how come there was no consult? Oh, we've consulted. Mr. Mayor, please, we certainly have consulted. In West Grey, Grey County has put forward that they are going to redevelop Rockwood Terrace. That tender has been let. Rockwood Terrace is not as much redeveloped. It's going to be a whole brand new building with 28 more beds on the 100 that are already there. I said to the CEO, you've taken this into account. You know, you're taking the inpatient beds. That's probably the most vulnerable population that we have in our communities, and you're taking a hospital away. Oh no, we've made, you know, there'll always be a hospital in Durham. And yes, we've taken that into account, and we certainly talked to the county about that. I sit as a county councillor and hadn't heard any conversations at all. Surprised me. And I said, the EMS station. Oh, don't worry, Mr. Mayor. The EMS station, that's not going to be affected. It is right at the present moment on the hospital site. And, you know, that there'll be no effect. At that point, I didn't use the word lying to me, but I said a month ago, Grey County purchased land from West Grey to build a brand new EMS station off-site. It is no longer going to be at the hospital. It's going to be right on Highway 4 as you're coming into Durham on the west side. Then it was her chance to say, oh, she was a bit speechless, because I think I really caught her at that point in time that no, there was no consultation. There was no consultation with any of the stakeholders other than the Ministry of Health, who have continuously said, no, this is a local decision. Yes, we're aware of it, but we're just not, you're very compliant with it. And it leads me to the thought, this is definitely a conspiracy. My conspiracy theory is, this is just the beginning of local hospitals. I see a few members here from Chesley that have been going through this for a number of years. There's been a bit of a plan on how Chesley's to remain open, and good for them for putting the pressure on. But Durham, this is just slightly different. The focus now is on to close rural healthcare. Move it to regionalization. I think you've heard from a number of the speakers here this morning that rural healthcare is different than large urban, that Mr. Ford and the ministry, Ms. Jones, understand and are pushing on to us. This isn't it. Brenda had said in a previous career, when I graduated from university, I was born and raised on a farm, graduated and farmed with my parents for a number of years on a farm just outside of Durham. Healthcare is changing. And living on a farm, we've seen things change. When I was quite young, I can go back as far as a neighbor of mine was still using a hay loader, which is bulk hay. For some people out there that don't understand what a hay loader is, at that time we were using a small square baler, putting it on wagons and hauling it to the barn. Things changed in agriculture. We went from that to stooking hay, to an automatic stooker, wow, to round bales. By the time I had retired from farming, we were using big square bales. Change is going to happen in healthcare as well, too. My point about hay is no matter what the changes were in farming, we always put hay in the barn to look after our livestock. Change is happening in the healthcare system, in our medical system. Care is being given differently. But that doesn't mean that we close things down and forget, totally abandon our livestock, our customers. And that's what I feel has happened here. The healthcare system is totally shutting down, not adapting change, but moving and taking it away, abandoning us, starving us, totally out. And it's been something that's been just happening. We can't stand back and let it happen anymore, or we're going to be starved. Starved of the healthcare that our country was built on. 98% of the world is very envious of Canada, of Ontario, for the healthcare that we've had and we've built. And here we have a Ministry of Health in Ontario that is starving us. I think I saw a sign right there, bleeding us out. We can't stand back. The fact that everybody is saying, oh, I didn't see it happening. I got a message the other day that yes, it has been happening for a while. I don't think that we're too late. We can step up. Ontario Medical Association, their newsletter, May 3rd, come out and said they were very concerned to learn that 2 southwestern emergency departments were permanently closing, which would mean permanently closing their hospitals. Chesley and Durham were the 2. That was on May 3rd that they put that out. So quite obvious, it wasn't a surprise. It's been something that's been going on. And for our MPP and a number of other ministry people that have said this, no, it's been something that has been cooking for a long time. It doesn't have anything to do, it has a lot to do with the staffing crisis. Yes, there probably is. There's a shortage. There's been overworked. But it's also been created. James Snowblin, 1998, Minister of Education. Do we remember that one? Caught on a hot mic. Create a crisis. That way we can manage it. This crisis has been created in rural healthcare. And the management is, we'll create the crisis, make the narrative, and close our hospitals. I'm not saying to you that I'm going to promise or that I'll just give effort. No, I'm going to continue to fight to keep Durham Hospital open, keep the fight in Durham. But my commitment more is that the war on rural health care, that's the battle that we really have to win. Put us together. We're going to have 2 buses going out of Durham on Wednesday to Queen's Park to get into the face of Sylvia Jones and Doug Ford and any other conservative that would like to step forward and listen to us. There's got to be a statement about that. And then, of course, I think there's a sign-up sheet here, even a bigger rally on May 30th. I really want everybody. It's not going to take my voice. It's going to take all of our voices to make this happen and to keep our hospitals open. Please, everyone, step forward and do it. I've got one individual here on a personal story, and she wants to say a word. If I could, Brenda, please. Miss Ray?
No, Sim. I'm a Sim, that's wrong.
But you're Ray.
Thank you.
Yep.
Thank you. Oh, close? Okay.
Yep.
My name is Michelle Sim, S-I-M. I grew up in Hanover. Hanover was a lovely place. Well, we grew up in Hanover, blah, blah, blah. We all grew away, moved away. My mom ended up living in Durham. And, oh, sorry, my mom ended up living in Durham. She had health issues. She was on dialysis. Thank heavens for the Durham hospital. She lived maybe 2 minutes away. So if something happened, they knew her. They were there to help her. If they didn't have it, she would have had to go to Hanover or Walkerton. She would have died. So we have to keep this together, this hospital. For my mom, who passed away 2 years ago, but it wasn't because of Durham. They did all they could for her. So please, we got to keep it together.
Thank you for that. And the fight has just begun. That's what I'm warning people out there in Queen's Park. North.
Well, thank you, Kevin. I know that he will be a wonderful and is a wonderful advocate for the community of Durham, and really that reflects on all rural and small hospitals. We need advocates like Kevin and the community of Durham to make our message louder and heard better. So thank you for bringing that message today. It's my pleasure really to wrap up today. I appreciate you all coming. It's been a little bit cold standing in that breeze, but I think it's been an important time. You know, the Ontario Health Coalition is a community of small grassroots organizations, over 400 grassroots organizations. And to bring about change, we often sit back and think that it's up to the government, the people that we elected, to bring about that change, when really the best and the most often the change comes from the grassroots. And that's you and I. It's the people who are here today. And it's up to us to spread that word and the messages that you've heard today, the information you've heard, the facts that you've heard. Please spread it to friends and neighbors and relatives who aren't here today. We had hoped, to be honest, to have a bigger turnout, and it just points out to us that it's difficult to get the message out. But more and more people are hearing about the crisis in healthcare. There are more and more news reports in the paper and on various media. We just have to get people to pay attention to it, because human beings tend to not take things too seriously or listen up until it affects them personally. And often once it affects them personally, it's too late. And my biggest fear is that privatization has been escalated and speeded up to such a degree by this government currently that if we don't act now, we can't wait 2 years to the next election. We have to make our voices heard now, or we're going to lose Medicare and we won't be able to get it back. You know, people sometimes say, well, I don't want my taxes to increase. And I say to them, well, you know, how are you going to feel when the medical bills start piling up? And the reality is the younger people, didn't have that experience. They don't know the families' histories that the older folks do and the effect it had on families. So we have to decide individually what our bottom line is. How much are you willing to take? And if you can afford to pay your medical bills now, well, that's wonderful for you. But what about your children and grandchildren? Are you sure that they're always going to be able to pay their medical bills in future if we lose Medicare? And by the way, do you just care about yourself? Or do you believe in the value that has driven Medicare in Canada and the value of Canadians, where we say we care about everybody? We don't just care about ourselves. We care about everybody. And that's why we have Medicare, and that's what Tommy Douglas fought for, universal access to Medicare for everybody. So it's a matter of priorities. The government needs to fund more, but they need, in my opinion, to get their priorities straight. I think when I pay my taxes that my money should go to government programs, social programs, service programs that address the needs of all of the population. I don't want my taxes going to multi-billion-dollar businesses and to the wealthy who already have enough money and who already can look after themselves. I'm not anti-business, but I do think that the balance in how our government spends its money is way off balance. What is happening to services in every sector, education, healthcare, justice, all kinds of sectors. The last thing I'd like to say, well, maybe it's not the last, but almost, is that don't believe the lies that are coming out of this government's mouths. They lied to us. Christine Elliott, former Minister of Health before the last election, let slip that they were going to privatize healthcare. And during the election, Ford denied it. It's just like I will not pave over the Greenbelt, or I will not touch the Greenbelt. It was, I am not going to privatize healthcare. Soon after the election, he announced his privatization of healthcare services plan, and he's been pushing it forward ever since. Privatization is not a solution. It's a choice that he made, and we as a group of citizens who believe otherwise have to press for a different plan, and there are other solutions. Ford also lied when he said we're not going to have to pay with our credit card. You're going to pay with your Medicare. Well, just tell the people who have gone to the private clinics for eye surgery, and now they're going to open up the hip and knee clinics, private clinics. Their goal is for profit first. It's not care first. And they upsell, they illegally charge, and it costs patients more. And the Durham situation is a perfect example of the kind of baffle-gab and the double-speak that comes out of this government. They did not announce that hospital was closing. But we of the Ontario Health Coalition know that when you don't have an emergency department, you don't have a hospital. If you don't have inpatient beds, they are changing the whole definition of hospital to it's an emergent urgent care clinic that's open from 7 to 5. That's not my idea of a hospital. So, if they don't outright lie, they then try to sell you with this language and redefinitions of what is real. And we have to see through that. So I urge you to come to the rally, the protest rally on May 30th. We have the bus sign up, or you can sign up online, and the website where you can do that is on one of the signs. I would urge you to help us distribute leaflets. We have 2 weeks or so, a little more than 2 weeks before the May 30th rally. And we have leaflets here today, which you can take some for your family, your street, your community, your sports group you go to, your euchre club, whatever you belong to. Take them along and hand them out to the people so they start to get informed. You can also sign up for a lawn sign, which was mentioned earlier. And I'd just like to close with a couple quotes. The one that describes Ford's plan that is rolling over, some would say bulldozing over Ontario, says, "That is the standard technique of privatization. Defund, make sure things don't work, people get angry, you hand it over to private capital." I think that's what's happening. And Tommy Douglas said, before he died in 1986, his words were prophetic. He said, "Unless there is a concerted effort to apply pressure on the federal and provincial governments, the erosion of Medicare will continue unabated and might even be accelerated." And that's today. So thank you once again, and please stay around if you have questions. Some of the speakers, Brenda and I, will be here. There's people at the tables who can help you, and we need at least 50 letters going to our MPP and to Ford in order to make an impact. I've had that on good word. So please write a letter, if not today, write one when you get home. We need to bombard these people with our message. Thank you very much.
Hi, Bernice. I'm Carol. Thank you so much for taking the time to speak with me today. I know we're in front of Owen Sound City Hall, and there is an important rally here today. It's about healthcare and some of the challenges with healthcare. So I'm wondering, what brought you here today in front of Owen Sound City Hall?
Well, I've been whining about our crisis in healthcare for a long time, and I decided to put my whining in my feet. So I have to get out and do something about it. We can't just keep complaining. We have to get up and do something. So that's why I'm here.
Excellent. What is it about healthcare that makes you whine? What's really concerning to you about healthcare?
The privatization of healthcare, the closing of rural hospitals, the treatment of our medical staff, long-term care. Someday I'm going to need that. And yeah, right now, there's no way I'm going into a home the way they are.
Yeah. Now, we've heard some speakers earlier. I know you know a lot about healthcare, but was there anything new that you picked up today that you weren't aware of?
Durham Hospital. I'd heard the rumors, but I didn't know exactly how it went down. I found that really informative, especially since I live in Chesley. And the Chesley Hospital is going to be next, I'm afraid, unless we do something.
Yeah, and without a lot of notification, there wasn't a lot of consultation from what we understand, and lots of concerns about that. So, if you had 3 wishes about our healthcare system, what would you say could help? What would you wish for?
Another Tommy Douglas.
Good one.
Changes in the consultation process and funding. We need funding.
Yeah.
It's a deliberate ploy, I believe, to defund healthcare. And we've seen it with other programs in the country, in the province. And this is one that I just take a personal stand in, that we've got to do something.
Excellent. Now, we are in rural Ontario, and you're in the Chesley area. Are there special concerns or things that you want those who make the decisions about to know about rural Ontario and why healthcare is so important here?
Well, rural is very different than the cities, and I moved here to retire to Chesley from a city. And the difference, I believe, is in rural locations. First, transportation is a problem. Roads are closed in the winter. The second problem is that we have a lot of Amish and Mennonite communities in this area, and they can't take it into a horse and buggy and go to the hospital.
Right.
They need hospitals close enough for them.
Yeah.
The next problem, I believe, is the whole idea of access to care in a timely manner. And in a small location like Chesley, a personal example, it isn't as accessible as it needs to be.
Yeah. Really, really good points. Now, there's a rally coming up. Can you give me some information about a really big one? We're hoping lots of people will show up.
It is going to be amazing. I went to my first one last fall, and there must have been 4,000 people there.
Wow.
All standing up saying enough.
Yeah.
We're anticipating double this time.
Wow.
And I truly believe that if we get enough people coming, Mr. Ford is going to have to listen.
So
right?
How can a person get involved in this? When is it?
Yeah.
Is there a bus going? What's happening?
It's May the 30th, and there's a short march to Queen's Park, and then it's at Queen's Park. Now, we have buses for that are more accessible for people with some issues. We also can take them right to the site. They don't have to walk.
Okay.
And we started out with one bus and a smaller bus for people with special needs. And we've gotten such a demand. We've got 2 more buses going.
Wow.
We're going to have a lot of people from Grey Bruce standing up in front of Queen's Park demanding that our hospitals be saved. It's going to be wonderful.
Wonderful. Now, this is the Grey Bruce Health Coalition, where you say we. That's who you're mentioning. So anyone who wanted to learn more about how to get involved, what do they do? Do you have a phone number? Is there a website?
We have a phone number and a website and an email address. I don't know off the top of my head, but it's on the brochure.
Yeah, and maybe we can ask Rogers to put it as a banner across the bottom. That would be their homework to do to help us.
That would be great.
I want to thank you so much for spending time to talk to me and for spending time to spread the word about how important taking care of rural health care and all of our people in Grey Bruce is. Thank you, Bernice.
Thank you.
And good luck with the rally.
Thank you.
Take care.
You too.
Thank you for speaking with me today. I'm really interested in knowing why you've come to this rally in front of Owen Sound City Hall. I know it's about healthcare, but you have a real interest in healthcare. Who'd like to go first?
I
Okay.
We have a real problem in Durham. I mean, they're closing the hospital. It affects everyone in the community, in the outlying area. And we cannot afford to allow that hospital to close. Doug Ford made a commitment back during COVID, and that was to improve health care. You don't improve it by getting rid of the rural hospitals.
Right. Were you surprised? Did you know about this in advance? Because speakers earlier said that there wasn't a lot of consultation. So did you know about this closing?
No, I was shocked.
Yeah.
And it's just not right.
Yeah. Yeah. How about you? And your name?
Norma Henderson.
Norma, yeah. And you were married, right? Yeah, yeah.
We are all getting older. We need to have local health care. There's a lot of times if you're sick, you haven't got time to drive for half an hour or so to go to a hospital. You need your health care immediately.
Yeah.
And what about people like the Mennonites use our hospital and so on? They have horse and buggies. It's a little harder for them to get to Mount Forest or get down to Walkerton or Hanover.
Yeah.
It just isn't fair to the people.
So you've come, both of you, from Durham up to Owen Sound because you're so passionate about this issue. Now, when we were chatting just before we started to tape, you're also planning on going to the rally. What would you say to our audience who's watching this program about speaking up?
Go to Toronto. Get your name on the list. Go to Toronto and raise Cain.
May 30th, right?
May the 30th, or there is a bus going this Wednesday as well.
Yep, yep.
So sign up.
Yep.
And get out there and show that you're angry about this.
Now, what can we do to fix our healthcare system? Both of you, if you had 3 wishes to help make this better, what would you say? What would you like to see?
We would like to see the service that we used to get years ago.
Yeah.
And our younger people, they don't seem to understand. They're not getting out there to support because they don't have to use the health care much yet. But they are going to get older too. And they will need it.
Yeah. How about you? What would you say if you had your wishes about the healthcare system? Obviously, you don't want Durham to close.
No, we do not want Durham to close. We need that hospital. We need Medicare for everyone, and it's not just the mayor's fight, it's everyone's fight.
Yep. I must say, both of you inspire me. You've come here to say this matters. You're going to the rally May 30th.
No, we're going this Wednesday.
This Wednesday, even sooner than that. And you're saying people in our community and across Grey Bruce need to speak up. I want to thank you both for being here and speaking to me today, and for what you're doing to try, not just for yourselves, but for all of the community to preserve our healthcare in rural Ontario. Thank you both so much. All the best.
Thank you.
Take care. Hi, thank you so much for taking the time to speak with me today. I know we're in front of Owen Sound City Hall, but all of you are from the Durham area, right?
Yes.
And I have some questions, but Dawn, I understand that you have a role involved with saving the Durham Hospital, is that correct?
That is correct, yes.
Tell me a bit about that, and then I really want to hear from all of you. We'll pass the mic around, why you're here today, why healthcare matters in rural Ontario. So, Dawn, tell me about your initiative, Saving the Hospital.
Our group was originally formed when there was the announcement of reduced emergency department hours.
Yep.
And then on April 24th, when the announcement came from the South Bruce Grey Health Centre that the inpatient beds were going to be removed and only having emergency department left at Durham, our focus really changed, and we feel that it's very important for both components to stay in Durham and that the Durham Hospital remains operating as it has for many, many years.
You were surprised by the announcement.
Yes.
I understand from the speeches earlier that it really did come as a surprise to a lot of people. What do you think will happen with the closure of if the beds move or are closed? What happens to the community? Where will people go from Durham? For those who are watching who may not know Durham area, where do people have to go then to get care?
Well, there's going to be, it affects so many things. It affects the doctors that maybe are going to stay or not stay. It affects, future, economic development.
Yeah.
It forces people to maybe have to go out of town for healthcare. And one thing is the emergency, to not know when it may be open or are there going to be further closures unexpected. And if you have an emergency, you can't waste that time searching for an ER that's open.
Yeah, exactly. And that we all know, even with accidents, stroke patients, timing is critical. Even to get care within an hour for someone who's a fresh stroke makes a big difference. Someone in trauma as well. So
yes.
Absolutely, being rural Ontario and not necessarily close to other areas, it matters. I'm wondering if you want to pass, do you have something else? You look ready to say
Just
something
another
more.
concern is what it's going to put on to our emergency services. Our paramedics and EMS are going to be potentially much busier. Right. Also, our first responders that are volunteers with the fire department, it's also going to put changes on to them.
And that's the ripple effect of, we talk about the beds, but it's all the other services that support a hospital and support a community in healthcare. So really, really good point.
Yes.
I'm going to ask, so what brought you here and what did you learn today that maybe you might not have been aware of, or anything new?
Hi, I'm here today as part of Save the Durham Hospital, but I have been involved with my friend Brenda Scott from the Coalition for a long time, and she's been asking me to join because we are both, in our history, we're both union advocates, and we have worked really hard with bringing people together and making sure that messages are clear. The biggest concern for me is the lack of transparency that has happened with the decision. It was a blindside. It looks like it's a well executed blindside when you look at what happened in Minden. The Durham community is strong. Durham community came together with the committee. They came together with volunteers the other night with over 100 people coming out to volunteer to save our hospital.
Wow.
This is really part of, although we're trying to save our hospital, this is the Conservative government's plan to privatize healthcare. This is another step. That's what I believe. That's what I feel is happening, is that we're part of a bigger plan in privatizing healthcare. Nobody will talk to us. Nancy Shaw is pokeroo. We can't find her. We don't know where she is. She won't come. She won't, how the decision was made was a concern. Durham is a split community. There's a population that is really aging within the community and needs health care. And then there is a huge development of younger, newer families that are moving in to the area. There is a subdivision of over 500 houses being constructed.
Right.
So what is a decision made? It appears to have been made on the corner of her desk. What is that decision going to do to rural health care in our community, and who's next? And let's have Sylvia Jones come talk to us. Come talk to and tell us how this decision was made, because we're pretty sure that the board did not make it alone. So that's why I'm here today.
And good point. Let's move it from the side of the desk to the center of the desk and look at it again, because it needs to have focus. And people need to say why it's so important. You raise a really good point. It's all ages, all spectrums that need, from families with young children where there are urgent situations, to the seniors who are more vulnerable and have chronic health conditions that need attention. Thank you for that. So, over to you. What would you like to add?
Well, as a lifelong citizen of Durham and the surrounding area, the hospital has been very important to me and my family. As well as I work at the largest private employer in town, and we have been around longer than the Durham Hospital has been established. So we have utilized them in and out for many services, emergencies included, some very urgent, from injuries to we've had heart attacks. Different things happen at our facility. So as a spokesperson for that company, I think it's very important to keep our hospital. Also, we're a big sporting community, and injuries happen. Hockey injuries, baseball, lacrosse. To have an emergency department close at 5 p.m., half of those games haven't started yet. So it's very important.
So the timing of the emergency hours, I'm okay. I'm mic'd. Thank you for sharing, but I'm already mic'd. It's okay. Nice of you to share. But that's another really good point, is that with the hockey events and that, and you need to have access to emergency care as well.
Very much so.
So for any of you who'd like to answer this, if you had 3 wishes about this healthcare system, what would your wishes be? What could make it better?
Yeah, that was exactly what came to my head too.
Transparency for decision making and why the decision, and stakeholder asking the stakeholders, input from the stakeholders.
So what would you wish for?
I wish for no changes.
Yes.
Keep the hospital open. Is that
That's
what
right.
I'm hearing you say?
Yes.
Yeah. Any other wish? Going once, going twice. They're good wishes. I want to thank you for being on the program and sharing. It's obvious that this is an important issue to the community, and obviously to each and every one of you. So thank you for speaking up.
Thank you.
Thank you.
Take care. Thank you. Thank you, Barbara, for taking the time to speak with me today. I know earlier that you did an amazing speech. We're here in front of Owen Sound City Hall. This is a rally about healthcare. And I have a few additional questions for you, because I'm hoping that you can fill in a little bit more. Certainly you came because you have a passion for healthcare and for taking care of people you've got experience across a variety of sectors. Was there anything you learned new today that you didn't know in relation to the issue about rural health care, or from the speakers, anything that surprised you?
Not really. I had gone to the rally on the Tuesday, and there I learned some things I did not know, such as the lab being dismantled, etc. But here, I've been paying attention to news, and it's pretty much just telling me again what's already out there about it.
What do you need people to do for their voice and your voice to join together? Because obviously you're speaking up, but what else can be done?
To speak up, strength in numbers, write to your government officials, don't take no for an answer. Well, try not to take no for an answer.
Yes.
Give them no mercy. Hold fast. Don't let them get away with this.
You are a PSW. And I know you say,
personal support worker. Yes.
But you had a professional personal support worker in front of that. What are you worried about as far as the individuals you care for? As a result of these changes, you see things happening. What are you most worried about?
Their mental health and well-being. I work in home care. It's better for them to be there. Sometimes it happens where things go so far that they need to be in those places. But as I had mentioned, the care is subpar, inadequate. Things are skipped, leading to terrible outcomes. And many of them that I've talked to said they don't want to go into those places because they hear about these things. They're in there, they're warehoused, and if they don't have family, they're forgotten. And then who speaks for them if they've got no one?
Yeah.
So here I am.
What would you say about your colleagues? I mean, I can't help but wonder how they're coping, with the stresses of wanting to do the best patient care and having all these changes. How are you managing with the stress, and how are they managing?
There is a lot of burnout out there. For one, working in home care, we're not paid very well. We're paid the lowest among them. But having worked in long-term care, I can't do that job because I can't be that brutal to people. We were given strict timelines. I could not meet them. But we worry about their health, their well-being, what will happen to them, because they can't, and they're afraid to speak up for themselves, and they have no family, and they just get forgotten and they fade away.
One of the responsibilities as a personal support worker and other professionals is advocating, speaking up, and that's what you're doing here today.
Yes.
You are speaking up, and you told the story of someone who couldn't speak up for themselves.
Yes.
That is so critical, that message. If they're not able to speak, you're able.
Yes.
If you had 3 wishes to help our healthcare system, what would you wish for? What can we do?
To fund it properly.
Yeah.
To undergo massive changes to make it what it should be. Follow the model that they have in Europe, where they have little towns. They call them dementia villages, I believe, especially with dementia. And just listen to the people.
Yeah.
They'll tell you what they want.
Yeah, yeah.
Stop brushing them off.
I want to thank you for taking the time. I was inspired by what you said.
Thank you.
Because I certainly listened to all the speeches, but I also appreciate your time. Thank you for caring enough to put your voice forward for those who can't.
Thank you.
Thank you. Take care.
You too. Thank you very much.
Thank you to all of the viewing audience who have watched HealthLink to learn more about rural health care and some of the challenges our communities are facing. Please tune in again to watch HealthLink to learn about programs, resources, and services that are available to you and to your family. And considering how important healthcare is to all of us, think about advocating to keep our hospitals open, our emergency departments open. Join those who are concerned, support by writing a letter, or consider attending a rally. Take care.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Connect with us by visiting our website or email us at comments@rogerstv.com. You're watching Rogers TV.
After a night out with your friends, there's always options for getting home safely. You could call your BFF, your mom or dad, whoever you can count on for a safe ride home. You could call your favorite cab company or 1-888 taxi guy. Or you could use the Arrive Alive smartphone app to help you choose your ride. Be it a friend, transit, or taxi, getting home safely is app easy. Now available for iOS and Android devices. Visit arrivealive.org to find out more. Arrive Alive. Drive sober.
Here are 3 reasons why your social strategies should include Rogers TV. Reason number 1 is we have hyper-local audiences. The community TV channel gives you a chance to engage with people where you live, so you really get to know your neighbors and they get to know you. Reason number 2 is we can help diversify your distribution. With social media, it's really important to be able to have a wider audience, and Rogers TV can actually help complement your online presence by delivering to a different audience. And it's actually really easy to repurpose your existing content or to just create new material specifically tailored for community TV. And finally, reason number 3 is we can help enhance your credibility and your trust. And by aligning your brand with Rogers TV, you can tap into that trust that viewers have. This can boost your reputation, especially among viewers who favor local businesses and value community involvement. 1, 2, 3. It's that easy to build your local audience with Rogers TV.
My name is Matthew Rutledge. I'm a 60 scoop survivor, born in Red Lake. Was adopted from there to Toronto at the age of 4. A lot of our brothers and sisters, family members got separated from each other. That was the government's goal, to break that connection from brothers and sisters. Basically taking the Indian out of the child. Right now, they're still trying to find themselves. Originally, my birth name is Harvey Halverson. In my high school days, teens, I was trying to fit into society. I knew I was First Nations, but I didn't know who I was inside. I think later in life, I started that journey. I am proud, Nishnawbe man, of who I am now. I love life, who I am.
Get ready for the ultimate sports talk experience. Join us every week for the most in-depth analysis, heated debates, and special guests. We give you action off the ice and off the field with all the drama and all the fun. Don't miss out on the sports talk show that's taking the game to a whole new level. Get your game face on and join us on RTV Sports Wrap.
Smudging is a very important part in our life as we're all learning to walk the good way. When we smudge, we use the sacred medicine, the white sage, the sweetgrass, the tobacco, and the cedar. It cleanses negative energy and replaces it by a positive energy. When I smudge, I cleanse my end and my eagle feather and start cleansing my breath to have better words. I will smudge my eyes so I could see the better things offered to me. I will smudge my ears to hear the good thing that people have to say. I will smudge my hair to have good thinking from my head. I will bring the smudge to my feet so I could walk in respect with our Mother, the Earth. Smudging is the way we give our prayers to connect our spirit to the Creator. We express gratitude for the gift of life, the learning, and growth.
With clubs, leagues, and courts in every province and territory across Canada, squash is the sport for wall-to-wall fun, fitness, and friendship. From coast to coast to coast. Learn to play and you'll want to do it every day. Squash. Play inside the box.
3 reasons why your social strategies should include Rogers TV. Reason number 1 is we have hyper-local audiences. The community TV channel gives you a chance to engage with people where you live, so you really get to know your neighbors and they get to know you. Reason number 2 is we can help diversify your distribution. With social media, it's really important to be able to have a wider audience, and Rogers TV can actually help complement your online presence by delivering to a different audience. And it's actually really easy to repurpose your existing content or to just create new material specifically tailored for community TV. And finally, reason number 3 is we can help enhance your credibility and your trust. And by aligning your brand with Rogers TV, you can tap into that trust that viewers have. This can boost your reputation, especially among viewers who favor local businesses and value community involvement. 1, 2, 3. It's that easy to build your local audience with Rogers TV.
This is Rogers TV,